So the right time to do Prokera is when it's appropriate for the patient. And there's times where we have patients with more chronic conditions. And for those patients, we may bring them back and educate them about the process and maybe even schedule it on a more appropriate time for them where they may be out of work or over on a weekend. But there's other patients who come in with more acute conditions, and for those patients, we'll do Prokera on them on the day of the visit and obviously explain to them the process and that they may have slightly blurred vision out of that eye.
We tend to do a little bit both of, as far as scheduling patients for later or doing it right away. For acute conditions, we have the flexibility to put it in right away because we keep them on site. For chronic conditions, we tend sometimes to schedule patients to have a Prokera insertion, and this allows us to keep the clinical flow going, even though the real time for insertion is actually relatively short. It allows us to document on both sides of what we're doing and also do a little bit more patient education around the chronic disease states.
For patients who have a dry eye, for instance, we may schedule the exact amount of time that they're going to be in the Prokera, and that may be 48 to 72 hours. And that's a question that it all depends upon the severity of the condition when the patient presented. For those patients who have a more serious condition, we may see them on a daily basis to just make sure that they're progressing.
So once Prokera is in the eye, it's really going to be dependent on the disease state that we're treating as far as what our clinical recall schedule is. For something of more of a chronic nature, we'll tend to let that go a couple days. If it's infectious in nature or there's a lot more tissue damage, this is clearly something that we follow typical clinical procedures for, as far as calling patients back, typically on a daily basis until we feel comfortable that the tissue is secure. Once the lens is removed, two things that you'll notice. You very often notice an absolutely pristine looking cornea. There is a continued regenerative effect that happens for anywhere from days to weeks after, and you'll still continue to notice this advanced healing